Diabetes is a chronic condition associated with abnormally high levels of sugar in the blood. In this video, I am going to explain how diabetes works, types of diabetes, and how diabetes is managed. Diabetes is a disease that occurs when your blood glucose is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose go from the food to get into your cells to be used for energy. Sometimes, your body doesn't make enough insulin, so then glucose stays in your blood and doesn't reach your cells. And this is what usually happens with a person with diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. If you have type 1 diabetes, your body does not make enough insulin, because your immune system attacks and destroys the cell in your pancreas that makes insulin. Type 1 diabetes is usually diagnosed in children and young adults. People with type 1 diabetes need to take insulin every day to stay alive. The next type is type 2 diabetes. If you have type 2 diabetes, it also means that your body does not make enough insulin or use insulin well. You can develop type 2 diabetes at any age. However, it's most common for middle-aged and old people. Type 2 diabetes is the most common type of diabetes. The third type is gestational diabetes, and it develops in women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. But what could high blood glucose lead to? It can lead to heart disease, stroke, kidney disease, eye problems, dental problems, and nerve problems. But how does diabetes develop? Diabetes could be caused by genes or an environment that makes you unable to make enough insulin to cover how much glucose you eat. The second way is when the pancreas cannot keep up with the increased demands and the excess of blood sugar starts to circulate in the blood, causing damage. The third and final probable cause is that over time insulin becomes less effective at introducing glucose to cell, and blood sugar levels continue to rise. Diabetes still has no cure, but that doesn't mean it cannot be treated, managed, or controlled. Adequate blood glucose control can be managed with careful attention to diet, regular exercise, home blood glucose monitoring, and multiple insulin injections throughout the day. There are different types of insulin, and the types of insulin that are currently available are, starting with rapid-acting insulin, which begins to take effect 5 minutes after administration. Its peak effect occurs in about 1 hour, and the effect lasts for 2 to 4 hours. The next one is regular insulin, and it takes effect within 30 minutes, and its peak effect is 2 to 3 hours after the injection, and it lasts 3 to 6 hours in total. The third type of insulin is the intermediate-acting insulin. It typically begins to lower blood glucose about 2 to 4 hours after the injection. Its peak effect is about 4 to 13 hours later, and it lasts 12 to 18 hours. The last type of insulin is the long-acting insulin, and it takes effect within 6 to 10 hours, and it usually lasts for 20 to 24 hours. This type of insulin usually doesn't have any major peaks or troughs. That's it for this video. Please make sure to like this video and subscribe for more medically related videos in the future. And also, follow my social media that will be given in the description below. Thank you for watching. Diabetes still has no cure, but
كريم انتبه